Hi everybody, it's Dr. Yurkiw here. Thank you for joining me today for this webinar called Join Us to Discover How Chiropractic Care Can Revitalize Your Health. And today we're going to be talking about how I practice chiropractic, how it can help you, and what you can do to help yourself. So thank you for joining me today. We're live here on YouTube. If you can just type in the chat where you're joining from, that would be great. We're also live on Instagram. And if you're on Instagram, maybe just type in the comments where you're joining us from. So my name is Dr. Yurkiw, and I am a chiropractor here in Kelowna, British Columbia. And make sure you stay tuned until the end of this webinar, and I'll give you a special offer. Whether you live in Kelowna or not, I'll have an opportunity for you to get some extra help. I have a question for you today. Have you seen a chiropractor in the last 12 months? If you're a patient of mine and you're joining me, thank you very much. I do let my patients know about these upcoming webinars. If you're not, have you seen a chiropractor in the last 12 months? Yes or no? You can just type in the chat right here on YouTube, and I'll just put yes or no, and then you can type right underneath that, just to survey our audience and see where they're coming from. The reason I'm doing this webinar today is to change and save lives, and that's our mission at the clinic, is to change lives of the people in our community. People come to see us, they're in a lot of pain. They are disabled because of the pain and the lack of mobility, and their quality of life is affected. So they're struggling with the things they love to do. It could be work, spending time with family, exercising, you name it. People are struggling to get doing those things they love to do, and they want to regain that ability. So at our clinic, our goal is to change and save lives of our patients and people in our community. And that includes you too. People that are viewing and watching us right now, we want to help you out. My qualifications, I've been a chiropractor now for 30 years, and I've seen over 10,000 patients in my career. Initially, I did a lot of locums, so I worked as a locum doctor, taking over for chiropractors that were going on holidays, chiropractors that got injured or were sick. And I did that for the first 3 years of my career, worked in over 50 clinics. And then subsequent to that, I've owned and operated my own clinic. I've worked in multidisciplinary situations. I've had my own administrative staff. So I know what it's like to work with other people in other disciplines, as well as a number of different conditions, because I've seen thousands of patients now. So I did write a couple books. A couple years ago, I wrote Back Pain. It's on Amazon. I also wrote a book called Neck Pain. It's on Amazon as well. Here's the Back Pain book right here. So it looks like that, and I'll give you a link later to be able to go and get that book if you're interested. And then this book right here on neck pain, that's on Amazon as well, and it's in ebook, paperback, and audiobook. So those books took me a long time to write. I think each time I do write a book, it gets a little bit quicker, but certainly you can go to those books and learn a little bit about neck pain or back pain and some of the conditions we treat. Just a disclaimer, if you're joining us, I would recommend that you talk to your health professional before you start anything new. So today we're going to be talking about different things that have worked for my patients in the clinic, but this isn't a personal recommendation for your health. It's important that you do get help. So go see a chiropractor. Excuse me, if you don't have a chiropractor and you're in the Kelowna area, certainly you can come and see me. We are accepting new patients right now. My story, as a teenager, I had a lot of knee pain. And my parents took me to our family doctor. He checked my knees. They were really sore, especially underneath the kneecap. And what he said was that I had growing pains and I would grow out of it. But this continued, and I was very active. I loved running, and I loved playing soccer, and playing hockey at the time. So that was affecting my ability to do these things. And my parents took me back to the doctor, and he checked my knees, said the same thing. So my father knew a chiropractor at our church, and he said, I'm going to book an appointment. We're going to go together. We went to see the chiropractor. He examined my knees. He took x-rays, And he was the first one to properly diagnose my condition. He diagnosed it. He said he was going to do treatments. He explained the chiropractic treatments. And he used a modality, a current on my knees as well. And then what he said was, over time, my knees would heal. And they did. And this was a very transformative experience for me because it inspired me. It inspired me to want to become a chiropractor so that I could help other people with their conditions. And here I am, 30 years later, more than that. And I've helped many, many patients over the years and continue to practice chiropractic. 3 things that I want you to take away and note today is how chiropractic works, how I practice chiropractic, and what you can do to live the chiropractic lifestyle. So I really want you to learn those 3 things today. So what is chiropractic? This is our first step. Well, it all started with a bone out of place, a subluxation, and that's the definition of a bone out of place. That interfered with nerve flow, and it affected the body's potential to work properly and heal. So over 100 years ago, Dr. Palmer was studying the spine and the nervous system. A person in his building came to him and said, he's got a bone out of place. He had an injury years ago, and this bone that's sticking out is affecting his hearing ever since the injury. And Palmer thought, if I could put that bone back in place, let's see if there's a cause and effect relationship. Would the person's hearing be restored? And so Palmer put the person on a table in his office on his side and pushed down on that vertebrae. The vertebrae realigned, and then what happened was the nerve flow got through and the janitor's hearing was restored. And this is how chiropractic started. It was that cause and effect relationship between the alignment, the nervous system, and the organ function. And to this day, the principle behind chiropractic is still the same. It's the body's potential to heal, the innate ability for the body to heal, but when there's interference, it can't function to the best of its ability. So that's what chiropractic is. And it affects the nervous system because we deal with the brain and the spinal cord. That's the main highway where the nerve impulses are traveling through. Thoughts and emotions drive this electricity, and then the brain is getting signals from the body coming back, telling the brain the environment you're in, hot or cold, stimulus like pressure, all sorts of movement, all sorts of receptors in the body that are sending signals back to the brain, telling us how the body is functioning. So this electrical system is very important. It's also a communication system. You can think of it like the internet, where there's electrical signals going back and forth from the brain to the body and from the body to the brain. Thoughts and emotions affect our electrical system. So depending on our thoughts and how we're feeling, electricity is created in the brain, and those signals are going down that spinal cord, out the nerves to different parts of the body. And there's those reflexes going from the body back to the brain. And so over time, thoughts and emotions can affect the tone of our body, how our body functions, the healing ability of our body, things like inflammation. All of those things are affected by our thoughts and our emotions. So how is chiropractic different from other professions? Well, we do believe in an innate approach that the body can heal from the inside out, that balance is important. That can mean a balance like postural balance, symmetry, right to left, front to back, and that our goal is to find bones out of place or subluxations, adjust them so they can be realigned, and our body can function the way it should be. So restore the body back to the normal function that it had before. So this is the chiropractic approach, different from other types of professions because other professions sometimes are more focused on the outside-in approach or very isolated approaches to the body. How do I practice chiropractic? Well, I practice with a structural approach. What I mean by a structural approach is I examine the person's posture, their alignment, take postural pictures, sometimes x-rays, and really want to understand their history, how this problem developed, and why they are the way they are today. So putting that all together, that gives me good information on getting a starting point. We do orthopedic and neurologic tests in the clinic, and basically all of that pinpoints the cause of the problem and allows us to start the treatment to correct that, the cause, so we can get the intended outcome. And as we do the treatments, then I put a treatment plan together to help the patient understand what they need to do to help themselves, as well as how long it's going to take for them to heal and when I'm going to do my reassessment. We do work on other joints in the body too, not just the spine, but we work on joints like the shoulder, the elbow, the wrist, knee, ankles, TMJ, the jaw joint. So accessory joints can get subluxated too, and that can affect the function of those joints. Most of the adjustments I do in the clinic are manual adjustments, so they're hands-on, traditional style of adjustments. I do use some contemporary techniques like the activator, the integrator to do adjustments. I use tables to do adjustments, especially in the hip region, where I pop the table up and push down to realign the hips and the lower part of the spine. I do use other techniques like decompression to take the pressure off the discs. And then other techniques like shockwave and laser. We do orthotics in the clinic as well. So all of those techniques are complementary to the main reason why we're doing adjustments in the clinic in the first place. How do I structure a treatment plan in the clinic? Well, I do a treatment and then I follow up. And I usually follow up initially in a day or two, see how the patient's responding to the treatments, and then do a treatment plan for them. And I'll do a treatment plan after a few visits, after 3 or 4 visits, and then say to them, here's what you can expect going forward. And during that treatment plan, I give the patient some homework, some stretches and exercises to do. Later on, I might recommend some lifestyle changes like diet, exercise for them. And I get the patient to participate in the treatment and in the recovery, because ultimately, long term, I want the patient to take responsibility for their condition, and I want to play a supportive role to maintain and prevent reoccurrences of that condition. Just keep the body functioning to the best of its ability. So that might involve some lifestyle changes, some physical activity, some mental stress management, and some nutrition. Those are very common things that we talk about in the clinic to help change the lifestyle and promote health and wellness. So what can you do? Well, you can take action today. And what I mean by action is if you have symptoms, things are just not right, contact a chiropractor and go see them. If you're in the Kelowna area, you can contact us. I'll give you an opportunity in a minute. I'll put a link in the show notes. Or if you're on Instagram, you can go to the link in the bio and click on that, and then that'll take you to the link to be able to book an appointment. But I encourage you to take some action today. Go see a chiropractor in your area, and then see what can be done for your specific problem. And then commit to the changes that need to be made, whether they're postural changes, lifestyle changes. Start making those changes now. Just take those baby steps, and then repeat them, and over time with repetition, you'll start to form some new habits and things will get better for you. So that effort is going to pay off long term. You can live a more natural lifestyle that will support healing. That includes the food you're eating, more natural foods, more organic foods, less processed foods, less sugary foods. The water you drink, more natural water, mineral water. Get a system, a water system that'll help you to drink healthy water, because our bodies are made up mostly of water, so that's very important. To be in a better environment, so an environment that is pro-healing. So whether it's you join a group like a yoga class, whether you're around people that are more positive and encouraging than negative and have bad habits. That's important too. and have the confidence that your body can heal from the inside out, that you have that healing ability, that that there is hope. So that's very important too. And I think that involves, just loving your body and caring for it. I think that's a good first step, is having respect for the body and treating it well, doing that for other people around you, taking care of others, going and getting adjusted on a regular basis to take care of any misalignments, any potential problems that are developing, and to get stronger. Make your body stronger through getting stronger bones, better movement of the joints, better posture and alignment. All very important. What can you do? You can tell others about chiropractic and what you learned today. You can encourage your family to attend a chiropractor, your friends. You can spread the word and tell people that there is hope and there is a potential for you to heal. My book called Back Pain is on Amazon. I'm going to put a link here in the show notes. If you're on social media, go to the link in the bio and you'll see the link there. If you're in the US, you will click on this link and it'll take you to Amazon US. If you're in Canada, click on this link and it'll take you to Amazon Canada. And that's my book on back pain. There's 3 formats to it. There's ebook, there's the paperback, and the audiobook version. If you need extra help and you're looking for a chiropractor in Kelowna, I'm going to give you this link because we're accepting new patients. And then when you click on this link and you're putting in your information, use the coupon code that it's asking for, called 25% neck pain webinar. So use that one right there. So type that in the coupon code. If you're not in Kelowna, but you do want to talk one-on-one with me, here's the link for an initial consult. So you can click on that and then book an appointment, a 20-minute initial consult. We'll just discuss some of the questions you have, and I'll direct you to a chiropractor in your area that can help you. I do have a master class, and the master class I offer to my patients, but you don't have to be a patient of mine to take the master class. In the master class, we talk about the intro and the mindset to improve your health. We talk about nutrition, exercise, sleep and stress management, and then we put it all together at the end. So if you're interested in taking the master class, I have a link, and I think it's on the next slide right here. Yeah. And the link is for 25% off taking the master class, and it's good for the next 7 days. So there's the link for 25% off taking the master class. It's a self-study class, so you can go at your own speed and just learn more about what we talked about today. If you want to follow me on social media, it's at Dr. Kerry Yurkiw on Instagram, Twitter, Facebook, and TikTok. If you want to go on YouTube, and I highly recommend you do go to YouTube, you'll get videos like this, and you're going to get updates when a new video is available or when we're going live, and you'll be able to see our slides too. So subscribe to our YouTube channel and like this video, because it really helps to be able to spread the word in our community when people are liking our videos and subscribing to our channel. We do have a podcast. It is on Spotify, it's on Apple, and it's on Google as well. It's called Super Healthy, and many times we'll post audio and video. Spotify allows video now, so we'll post audio and video of webinars like this, or tips and stretches, anything that can help our patients or help people in the community. So you can always follow our podcast. It's called Super Healthy, and just subscribe to that on Spotify, Apple, or Google. And I want to thank you guys for joining me today. It's been a pleasure talking to you. I really enjoy doing these Saturday morning webinars. Please watch for upcoming webinars on Eventbrite and on our website. If you're a patient at the clinic, I will text out to you or email you updates on when the webinars are going to be. And then I look forward to seeing you either in the clinic soon or back here on social media or on YouTube in the near future. Have a great day.